We just heard from BC's Chief Medical Officer of Health, Dr. Bonnie Henry. She says that the province is declaring a state of emergency. Alberta, Ontario, PEI, and Quebec have also declared some sort of public health emergency. Today as well, though, the Southern Chiefs Organization declared a state of emergency. That declaration affects 34 Manitoba First Nations communities the organization represents. Now, there is a lot of concern about how the spread of coronavirus might impact Indigenous communities. The Prime Minister was asked whether he's doing enough to address that earlier today. Have a listen to what he had to say.
From the very beginning, we have been working closely with Indigenous services, with Indigenous leadership across the country to ensure that what is needed to be done will be done for Indigenous and remote communities. We know that there is a higher degree of vulnerability. There are already vulnerabilities because of difficult conditions in so many of those communities. That is why we are taking extra measures to ensure that Indigenous people across this country remain safe.
Let's bring in Perry Bellegarde. He's the National Chief of the Assembly of First Nations. He joins us now from Ottawa. Hi, National Chief Bellegarde. Nice to see you.
Hi, Vashi.
Let me ask you first, if you could identify for us and for our viewers exactly what kinds of challenges Indigenous communities are facing because of the spread of coronavirus.
Well, we have 634 First Nations across Canada, but 96 are isolated. They're fly-in communities. So they don't have access to a hospital. They've got nursing stations, and half the time those nursing stations aren't manned properly with the proper doctors or the nurses. So having access to proper medical care is number one, is going to be key. But as well, having access to hand sanitizers, ventilators, masks, bottled water, soap. There's already overcrowded conditions already in those communities. 10 to 12 people living in a 2-bedroom house. A lot of the communities don't have access to potable water. So it's really challenging. So I stress that there's got to be a very specific strategy and plan for the First Nations in the North that are isolated. And that's the key thing. And we also said there's an issue of transportation. Once people do get sick, medivacs, charters out, all these have to be part of a very important plan for the North. So that it has to be in place.
So what kinds of assurances have you received from the federal government to those asks?
Well, we pushed to make sure that out of that $1 billion that was available, there's $100 million available for First Nations, Métis, and Inuit peoples. And our chiefs are saying, we just finished a conference call today with our AFN executive, and the message we heard loud and clear was we have to get those resources out very soon, right now. And there's a sense of urgency to get those resources out. And how do you access them? So right now it's via the regional director generals, if you will, through Indigenous Services Canada. And so we have to make sure that there's very effective and efficient ways of getting those resources out now. And that was the big push. And again, the 100 million is not capped, based on needs. Once the needs are even greater, if you document that, then it should be supplied back to the First Nations to make sure that these people aren't forgotten, they're not left out.
Let me ask you, though, because that initial announcement is to be followed by another bigger one tomorrow. My colleague David Cochran is reporting it'll probably be in the neighborhood of $25 billion. What are your expectations for Indigenous communities? Do you think that there will be more money for the kinds of things that you're talking about?
Well, again, there's a pot of money for COVID-19 and dealing with the health crises. Then there's going to be an economic stimulus pot of money. And that's a whole separate dialogue and discussion because First Nations are going to be affected as well by that second pot. They need to have access to that $25 billion as well, whatever's announced. But going back to this is a major health crisis. Mm-hmm. We want to deal with that first and foremost. And so even in the North, there's northern stores or co-ops. They're fast running out of food. They're fast running out of bottled water. They're fast running out of all these things. And so looking at ways to get them into the North, even looking at keeping the ice roads open longer than usual. So we've pushed the Prime Minister and the federal provincial governments to look at leaving the ice roads open a little longer and to make sure that those services and goods can get up into the North. So all these things have to happen sooner than later. So there's that $100 million that's available immediately. And then the economic development stimulus pot is another pot. And then First Nations have to be part and parcel of that as well, because we're going to have economic impacts on a lot of First Nations across Canada.
Have you talked to the Prime Minister about this stuff?
I've talked to the Prime Minister on last Friday, and that's where we talked about that accessing the $100 million. And it's, again, the most effective way is via the RDGs through Indigenous Services Canada. We haven't had a dialogue. I did flag the economic stimulus resources is another conversation. We have yet to have those discussions, but I just want to echo that First Nations have to be part of that as well, and to make sure that our businesses and communities aren't affected in a negative way as well. So we have to have those discussions on the economic stimulus part yet.
When you talk about the urgency of getting that health money out and getting it out fast, National Chief Bellegarde, what do you know about how much is even out the door? Is any of it?
No, it's slow. You know, it was just announced on Friday, and we heard from Chief Mercury from Fond du Lac in northern Saskatchewan. He has 2,100 people in his community, and he tried to charter in by bulk goods, you know, to come to the community, which was refused. So there's a glitch in the system somewhere, and we can't have that. We've got to get the goods and the services up into those 96 communities in a very, very fast way. If this virus, and when it does hit, it's going to be rampant. And there's a big fear that once that happens, we're not going to be able to meet those needs. And, you know, it's a lot of our elders in the community, a lot of people that already have their systems that aren't really strong enough to battle this. It's going to have a huge impact.
It sure will. I appreciate you sharing some time with us to discuss all of this. Really appreciate it, National Chief Bellegarde.
Thanks, Vassie.
That's the Assembly of First Nations National Chief Perry Bellegarde. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.